Today, we explore the fascinating biological mechanics behind erectile dysfunction medications and how they impact the human body. Understanding this complex process requires a deep dive into our anatomy, observing the intricate vascular structures inside the male reproductive system carefully. Let us begin examining a detailed cross-section of the penis to identify the critical components responsible for achieving a successful erection. The essential structures are the corpora cavernosa, which are two large cylindrical chambers running along the entire length of the male organ. These specialized chambers contain a vast network of spongy tissue and blood vessels, playing a fundamental role in the physical erection process. When sexual arousal occurs, and the brain sends rapid nerve signals down the spinal cord directly toward the pelvic region's specific blood vessels. These crucial nerve impulses trigger the release of a powerful chemical messenger called nitric oxide into the surrounding vascular smooth muscle tissue. Nitric oxide acts as a vital key, unlocking a complex biochemical cascade that ultimately transforms the physical state of the male organ. Once released, nitric oxide binds to receptors and activates a specific enzyme known as guanylate cyclase within the smooth muscle cellular structure. This activated enzyme immediately begins converting common cellular molecules into a specialized substance called cyclic GMP, which drives the entire physiological response. Cyclic GMP is the ultimate hero here, signaling the smooth muscle walls of the penile arteries to relax and expand quite significantly. As these arterial walls relax, they widen dramatically, allowing a massive rapid influx of blood to rush into the empty corpora cavernosa. The sudden rush of pressurized blood fills the spongy tissues, causing the entire structure to expand, engorge, and become rigid almost instantly. Simultaneously, this rapid expansion physically compresses the veins that normally drain blood away, effectively trapping the blood inside to maintain the erection. This delicate balance of increased arterial inflow and restricted venous outflow represents the precise mechanical foundation of a healthy, sustained human erection. However, the body must possess a natural mechanism to reverse this process and return the organ to its normal, relaxed, flaccid state. To achieve this necessary deflation, the body produces another specialized enzyme called phosphodiesterase type 5, commonly referred to in medicine as PDE5. The primary biological function of the PDE5 enzyme is to actively break down and destroy the cyclic GMP molecules we discussed earlier. When cyclic GMP is destroyed by PDE5, the smooth muscles contract, arteries narrow, and blood safely drains out through the uncompressed veins. For men suffering from erectile dysfunction, this delicate biochemical system is somehow compromised, often leading to weak or completely absent physical responses. In many cases of erectile dysfunction, the PDE5 enzyme breaks down cyclic GMP too quickly before a proper erection can be achieved. This premature destruction prevents the necessary smooth muscle relaxation and completely ruins the vital blood-trapping mechanism required for healthy sexual function. This is exactly where revolutionary medications like Viagra, scientifically known as sildenafil, step in to artificially correct this frustrating biological chemical imbalance. Viagra belongs to the class of drugs known as PDE5 inhibitors, meaning its sole purpose is to block that specific destructive enzyme. By temporarily disabling the PDE5 enzyme, Viagra allows cyclic GMP levels to build up and remain active inside the smooth muscle tissues. With cyclic GMP surviving much longer, the penile arteries can relax, expand properly, and allow the necessary blood flow to create rigidity. It is absolutely crucial to understand one major misconception about how these famous blue pills actually work inside the complex human body. Taking a PDE5 inhibitor like Viagra will not automatically cause a spontaneous erection without any external input or natural psychological sexual desire. Because the drug only stops the breakdown of cyclic GMP, your body still needs to produce cyclic GMP in the first place. That initial production of cyclic GMP requires nitric oxide, which is only released when a man experiences genuine physical or mental arousal. Therefore, without proper sexual stimulation to initiate nerve signals and nitric oxide release, the medication will essentially do absolutely nothing at all. Proper usage and timing are also incredibly important factors for anyone looking to maximize the effectiveness and safety of these prescription treatments. Doctors generally recommend taking Viagra approximately 1 full hour before engaging in sexual activity to allow the active ingredients to absorb completely. Patients must be aware that consuming heavy and fatty meals before taking the pill can significantly delay its absorption into the bloodstream. When taken with a greasy burger or large steak, the medication might take twice as long to work or be less effective. Alcohol consumption should also be heavily monitored, as drinking too much can impair nerve function and completely counteract the specific medication benefits. While Viagra is incredibly famous, it is not the only option available on the market for treating this extremely common male condition. Another highly popular alternative is Cialis, scientifically known as tadalafil, which utilizes the exact same PDE5 blocking mechanism but lasts much longer. Viagra remains active in the body for 4 hours, but a single dose of Cialis can remain effective for 36 hours. This extended duration of action has earned Cialis the popular nickname of the weekend pill among medical professionals and everyday grateful patients. Despite widespread success and general safety, PDE5 inhibitors are powerful pharmaceutical drugs that can unfortunately cause various uncomfortable side effects for users. Because these medications cause blood vessels to dilate and expand, their effects are not always strictly localized to the pelvic region alone. Unexpected dilation of blood vessels in the brain can frequently lead to throbbing headaches, which is the most commonly reported side effect. Users may also experience sudden facial flushing, nasal congestion, or a warm sensation spreading rapidly across their chest and upper body areas. A fascinating and unique side effect of Viagra involves vision changes, where patients report seeing the world with a distinct blue tint. This visual phenomenon occurs because the drug can mildly interfere with another related enzyme found directly inside the retina of the eye. Most importantly, there are severe and potentially fatal medical contraindications that absolutely must be discussed with a doctor before starting this medication. Anyone currently taking nitrate medications for chronic chest pain or severe heart conditions must completely avoid all PDE5 inhibitors under any circumstances. Combining nitrates with Viagra causes a dangerous synergistic effect that violently drops blood pressure to critically low life-threatening levels in minutes. This catastrophic drop in blood pressure deprives the brain and vital organs of oxygen, potentially leading to fainting, stroke, or sudden death. Understanding the precise anatomy and complex biochemistry behind these modern medical marvels empowers patients to make highly informed and safe health decisions. Thank you for joining this incredible educational journey through the human body. Subscribe to Video Creator for more fascinating biological discoveries today.